This is a market that absolutely needs regulation. There were just these nodules all over her lips. Even I could see even 48 hours later, it was not right. And then she told me what she'd paid for the treatment. And it was £18, 1.8. And the patient was sort of sat there going, in hindsight, there was a lot of red flags. People were like, well, how have you done it so quickly? It's like, well, I've worked harder than I've ever worked in the last 3 years. If you want to make it a success, it's your business. The buck stops with you. And ultimately, you're going to get out what you put in.
Today we had Jenny Doyle on the show, who is a consultant oculoplastic surgeon and COO and co-founder of the clinic Holland Park. Jenny has an extremely successful NHS career. However, she also, on top of that, runs a very successful private clinic in the heart of London, whilst juggling a number of key relationships with very well-known brands as well. She's enjoyed a meteoric rise in the medical aesthetics industry and is regularly featured in trade magazines and one of the leading authorities and experts in the medical aesthetics field. Jenny juggles a lot of plates and she makes it look easy, but she works incredibly hard behind the scenes to make it all work. Today, Jenny shares her story with us, from how it all began through some of the challenges that she's faced to how she juggles such a successful career in private while still keeping her grounds rooted in NHS. Join us as we dive into her story. Right, welcome to the show today. We're super excited to have Dr. Jenny Doyle with us today from the clinic Holland Park. Many of you will know Dr. Jenny Doyle. She's had a meteoric rise in popularity in the medical aesthetics industry. So we can't wait to share her story with you and dive straight into that.
Yes.
Right, Jenny? Thank you so much for joining us today. Really kind. I know you're a very busy woman. You're in high demand, so we're very grateful that you're sharing your story with us today.
Thanks for asking me.
Yeah, and everyone watching as well. I think they're going to be able to learn a lot about your journey and also your sort of meteoric rise in the last few years. So you've done a phenomenal job of juggling it all, which will definitely be one of our questions. But Laurie, do you want to kick off with our usual rapid fire round?
Yes, we always start a little bit light to ease you into it. So they're just quick fire this or that, first instinct answers. Okay. So surgery or aesthetic devices?
Which do I prefer? Okay, well, I think they both have their place. And I think when you're looking at your practice, and what we've tried to do at the clinic Holland Park is really kind of cater for everyone, because there's not sort of a right answer for everyone, depending on their concern, depending on that patient. So obviously being able to offer surgery is great, and we can get some phenomenally, impressive results with it. But I think what we're seeing in the market trends is not everyone wants to undergo surgery. They're scared of surgery, or they can't do the downtime for it. And that's where aesthetics has really sort of taken off. It's really offered people a way of improving concerns that they may have about their appearance without undergoing a lot of downtime or risk or cost, really.
Yes, definitely. London or the countryside?
Well, we split my time between the two. So, yeah, obviously we've got the clinic in Holland Park and I spend about 3 days a week there. But I do live in the countryside and I have done for the past sort of 10 years or so now. I love riding, I have horses, we've got a little small holding with sheep, etc. And I really like the contrast of it. And actually before the clinic in Holland Park, I started off my aesthetic practice in Bicester, which is not tab local to me. So I was doing sort of full-time surgical ophthalmology training. And then in my evenings and weekends, I was training for Harley Academy and had my small clinic locally in Bicester. So in a little village called Stratton Audley, which I still do that clinic actually on Tuesdays every other week. Don't have all the fancy devices, sadly, but injectable skincare, the kind of basic stuff we can still offer there. I think it's a great contrast, and I really like the kind of quiet of the countryside and then coming into town. It complements well.
Nice. I mean, this is not part of the quick fire, but just listening to you, do you find the patients different?
Absolutely.
Yeah?
Yeah, I think in London, people are very much like on the hottest trends. We know that from the US stats, like laser resurfacing, for example, has now overtaken dermal filler as treatment number 2. Wow. So it's Botox and then it's laser resurfacing in the US. And I think London very much, the market here, the patients here are watching. Yeah, they're watching more. A lot of them are, a lot of people do kind of travel a lot to the States. They're seeing what's being done there. And their appetite for device-based treatments is great. Whereas I think in the countryside, what I see from the patients there is their appetites are a lot more traditional still. They haven't that kind of marketing or, the attitude around kind of regenerative medicine or energy-based devices hasn't necessarily spread as far. I still get some patients who, because the nice thing about having kind of cross sites and commutable within each other is I can kind of still tell my patients in the countryside what all the options are. And some of them do travel down to London for the energy-based device treatments. But yeah, their appetite for fillers particularly is still greater than what I see in London.
That's so interesting.
So do people have, in the countryside, do you find that people have slightly more conservative approach?
Yeah, I think so. Yeah, I think more conservative approach. Also looking to not spend as much of a budget on it. I think a lot of it, and I have quite an outdoor lifestyle. And when I see, the costs of some of the treatments, you're sort of comparing it to, I don't know, a new horse or something like that. And I think, the attitude of people in the countryside is, again, slightly more conservative with what they're willing to spend on these treatments.
Yeah, that makes sense.
Fair enough. That makes sense. Last one for you. First patient of the day or last patient of the day, which one is the hardest?
Oh, that's a good question, actually. Usually it's the first of the day because they're often running late. You know what it's like getting across London. And I pride myself on trying to never run late, so that the most people will have to wait is 15 minutes. And that's on a really, really bad day. It will happen occasionally, but I like to run our clinic as a tight ship. But of course, if someone is running a bit late, it can put your whole diary out of whack. And we try and accommodate, but often it's like the swan analogy where we look like we're gliding on the surface, but actually you're kind of running around in the background trying to get that clinic back on track.
Yeah, I can imagine that takes me back to the stress of if someone's running late, because you're always thinking about the next patient. You're not actually thinking about the one that's late. You're like, we'll deal with that. But when they come, it's like, then I've got to deal with the next problem.
Exactly.
Absolutely.
I mean, I feel like 15 minutes is sort of like a forgivable window.
Yeah.
Sort of tolerate that, I think. Especially, obviously we've been into your clinic, so it's a pleasant environment. It's not an anxiety-inducing environment. It's a really... It feels like a spa-like experience.
Yeah, absolutely. But I never run late. I'm with my team. I'm always pathologically early. And when I had a new member of staff start, the other members of the team were like, by the way, Jenny is literally the first one here and last one out every single day. So don't run late. She doesn't do late.
Yeah, fair enough. I guess that's why you're a COO as well, right? You run a tight ship.
Run a tight ship with a good team supporting it, of course.
Yeah, of course.
Yeah,
absolutely.
Now, for those of you who don't know you, I mean, there's not going to be many of them, I think. Maybe could you tell us a little bit about your journey? Obviously, we've talked about the clinic in Bicester.
Yeah.
But maybe sort of dialing back and starting a little earlier, and how you actually ended up, co-founding the clinic Holland Park and running it and doing what you're doing today.
Yeah, absolutely. So obviously started off in medicine. I actually did my foundation years here in London and then moved out to the countryside when I accepted a registrar post for ophthalmology. So for eye surgery, you accept sort of a 7-year posting somewhere to become a consultant. And at the time, we'd moved down to London. My husband was working in the city and I just didn't love living in the city. I kind of missed the peace and quiet of the countryside. So accepted a job back in the Oxford Deanery, which is where we'd met at university anyway. And about 2-3 years into that, a couple of, I think aesthetics was sort of starting to really gain traction. This is sort of 2017 time. And a couple of close friends said, well, Jenny, aren't you doing Botox anyway for your patients in ophthalmology? We treat people with facial spasms, with blepharospasm. And at the time I was considering doing oculoplastics. I'd just met my now business partner, Richard Scorn, who was his registrar and then his fellow who trained me in all the oculoplastic surgery side of it. And I think at that time, it seemed like a really good fit to add on to the practice because we were already familiar with some of the injectables like Botox anyway. I then started the level 7 at Harley Academy with 2 of my best friends from medical school. They're both GPs. Great. They're both still in aesthetics as well, splitting their time. And we thought, this is just something fun that we can all learn together. We can all, spend our weekends doing the level 7, learning it together. And even if it never took off from a business point of view, we all had an interest in it and thought it's something fun that we as a friendship group could do. Started off there with my Vista clinic, as I mentioned, and then did that for a good few years, evenings, weekends, also training for Harley Academy. And then as I was sort of doing my fellowship year with Richard and coming towards the end of that journey and looking for a consultant post in ophthalmology, Richard had this idea of setting up a sort of super clinic where we could bring everything under one house, so surgery, injectables, but also support from a multidisciplinary team. And I think within aesthetics at the time, that sort of collaboration was really missing and there's a bit of a disjoint between surgery or injectables, and that he was certainly feeling that a lot of his patients might be coming in looking for surgery but then asking, where do I get all the rest of my injectables and things done? So the idea was to sort of bring it all in under one roof, and we'd spoken about it in the planning and just looking for the right sort of environment to set up. And then he asked me to come on board and help run it with him, which was nice. I think he saw that I ran a tight ship within our NHS practice, and that's what you need in business as well. That's a great story. I mean, from sort of inception of the idea and that first conversation with Richard, how long did it actually take you to find the space? Because you've got an incredible location. We do. I mean, I think we'd started talking about it. It was a couple of years before, at least 2 years before actually finding the space and then obviously getting it sorted and launching. I think, our initial conversations have been about 2 years prior to that. So it was not an overnight thing.
I mean, you mentioned obviously there being a gap in the market, and I think still, I mean, there are not many clinics who kind of offer the range of disciplines that you offer, or indeed are sort of surgeon-led, if you like.
Yeah.
One of the things that we struggled with the medical aesthetics industry when we first got into it sort of 3 years ago or so, because we came from a background of cosmetic dentistry primarily, was just how fragmented it is, and just kind of getting a head around the fact that on the one hand, you have salons that are injecting often kind of incorrectly or wrongfully or not adequately trained, and salons have devices. And then on the other end of the spectrum, you have clinics like yours, which are top end, completely medically run and the highest possible standards. And just that massive disconnect, because in dental, you need to be GDC registered, you need to have CQC registration. There's a certain expectation of, cross-infection controls, all that kind of stuff, compliance. And that's obviously a barrier to entry. And so that for us was really tough to get our head around. And also just the different personalities that are involved in running those types of clinics. So has that ever been for you kind of like a concern of how do you sort of
differentiate?
Yeah. See, on credentials, etc. But was that ever a concern for you going into the industry?
No, I think not. I think if you attract the patients you attract by how you present yourself. And patients coming to me, I might be doing an energy-based device treatment that for sure a good therapist could do. But the reason they're coming to our clinic is that they want someone super qualified to deliver that. And I think in the location we're at, but also the price point we've set ourselves at in the market, patients aren't paying for a product, they're paying for your time, they're paying for your expertise. And I think when patients are looking at the market, it can be quite confusing for them. But now there is more awareness about it. There's been lots of things in the press recently with bad outcomes, for example. I think it is making patients a bit more aware, and hopefully the legislation to support that will be following shortly. We see a lot of complications coming into the clinic that are self-referral. And I think so we have an ultrasound device so that if I'm doing a filler treatment in a high risk area, we use that. And one thing I found once we sort of put that on our website was people were often searching for, say, ultrasound or something like that, and then they were coming in saying, I've had this happen, can you help me? And we do see a lot of complications. It's not something that I really want to bring into the clinic because they take a lot of your time. You're never going to really treat them as a patient because they're usually pretty fragile, to be honest. And the management of these patients is pretty complex. And I think it's only when something goes wrong that patients kind of reflect and maybe see the error of their ways. I have a patient she's a long-standing patient from the countryside actually, for botulinum toxin, came to me because she wanted it done well, and I got a message one day, she said, I've done something really silly, I've had lip filler and it's really bad, can you help me? And I sort of replied saying, well, how long ago was it? 48 hours. And I just said, it's probably swollen, just let it all settle. And she said, no, I need to see you. I said, okay, I'm in London, you can come in. And there were just these nodules all over her lips. Even I could see even 48 hours later, it was not right. And then she told me what she'd paid for the treatment, and it was £18, 18. And the patient was sort of sat there going, in hindsight, there was a lot of red flags. I didn't check they're a medical professional. Obviously, the price point should have alerted me. And whatever had been injected, we tried to dissolve it. It wasn't dissolvable, so obviously it wasn't hyaluronic acid. So we ended up having to sort of manually express this product from her lip, and it's cases like that that I think need more awareness, and the patients that undergo these horrible complications, I think would be the first to say this is a market that absolutely needs regulation, and people need to be aware that things can go wrong. And even in the most experienced hands, everything can go wrong. When I'm consenting patients, I tell them every procedure has a risk. Even if it's done by the best person, we all have complications. And it's knowing that treatment's being done in the safest manner to minimize your risk of having that, but also that whoever's doing the treatment can help you should something go wrong.
Complications, God, that's a terrible story. I mean, also because of your existing relationship, the fact that she trusted you, she probably felt very embarrassed about.
Yeah, she did.
And thankfully, she sort of reached out. She could have become sort of.
And I think you've got to have it from like a no judgment point of view. Equally, because we've got ultrasound, we do a lot of complications management. I see patients with body dysmorphia, and they come in not for filler with me. I tell them never have it, but they come in for the management if it's gone wrong, and obviously it often does because their perception of the result they wanted is usually negative. And for those patients, I think always got to have an open door. And obviously I tell them, you shouldn't have any more of these treatments. It's not going to help you. But you can't prevent other people injecting. You can't prevent them going, seeking treatments elsewhere. So just being a safe space where they know they can come for complications management. So I think just something that is part of the duty, really. Yeah.
And do you think, well, in the US, I've noticed that aesthetics in particular is really high regarded. It's probably on the same level as any sort of medical treatment, especially in LA and New York, where they seem to do a really good job with regulation. Do you think it's a case of perception that needs to be changed in the UK, that aesthetics is not to be played with, that it is a medical treatment that you're having? Do you think that's where the work needs to start as well?
Yeah, I think it's from both aspects, because these treatments work. We know they work. People mostly, even if it's done by a non-medical professional, on the most part, people are getting good results. And for most of the market, the price point at some of the big clinics, certainly somewhere in London, for example, would be out of reach of most of the public. So there's a huge demand for these treatments. And it's just matching that kind of the accessibility of that, I guess, with it being done by someone who's professional, who's well trained, and that's tricky, because I think you're never going to stop people wanting these treatments. And if they feel like they can reach their goals at an affordable manner, they may take the risk of that. It's the same with sort of health tourism. We see patients flying abroad for treatments if they can't afford it here. It's the same sort of thing. People are willing to take the risk in some ways if they feel that they can afford the treatment. And I think as an industry and as a country, we do need to protect people.
Yeah, definitely. We see a lot of that, don't we? Well, a lot of it being a problem in the dental
dentistry also. And I think there's a few bariatric surgeons that we work with or done bits and pieces with, and it's a massive problem.
Yeah.
People go and have bypass surgery abroad, and there's no follow-up care. There's no continuity of care. I mean, it's just... And things can go horribly wrong.
Absolutely. I remember as I was a senior registrar still, I wasn't a consultant by this point. It was a Sunday afternoon, and I got a phone call from A&E saying someone's had a blepharoplasty and privately, and the wound's all opened up. Can you come in? And I said, well, if they've had it done privately, they should contact their surgeon, because you've got a duty of care.
Yeah.
And the response was, well, she had it done abroad in Turkey, and she obviously can't get back there, so had to call in the entire there was an open wound essentially, and patient was really distraught by it, so called in the entire on-call theatre team. And even in hours, an NHS theatre costs £20 a minute to run. So imagine what it would cost out of hours to call in that team. And as I was sort of stitching the patient back up, I asked her, well, why did you go abroad? She said, well, I couldn't afford to have it done here. You think, now the NHS is picking up the cost. It's probably more than what the initial cost would have been had you have done the operation here.
Yeah.
That is insane. Yeah, it makes complete sense. And I don't think people think about the repercussion. It's always about the outcome being positive, and seeing, TikTok in particular is a very big one for that. And I've seen a lot of advertisement from content creators pushing that and having parties and going on flights together as content creators, and it's quite scary that it's being promoted that way.
Yeah, I think we need to be really careful about belittling these treatments, because they are medical treatments at the end of the day. Things can go wrong, and it's only when things go wrong that people have hindsight and sort of regret. When it goes right, you think, hey, I've got away with it. But yeah, when things go wrong, they can go spectacularly wrong.
What do you think is the best way to sort of educate the public? Because I think the finger wagging sort of hasn't really worked.
No.
I mean, it's and if you look at the trends of medical tourism, it's kind of an upward trend.
Yeah.
So if it's not the sort of naysaying and scaremongering and rightful scaremongering and finger wagging, what should the narrative or the message be, and how do we sort of prevent, because I think, from a marketing perspective, Turkey is and it's not just Turkey, but let's use Turkey as an example, is a marketing success story.
Yeah.
Because actually, you fly over there, you get picked up by a chauffeur, you get a nice hotel, you spend some time in the sun, holiday, you come back looking and feeling great, whatever. Maybe that's not always the case, but it's a marketing success story.
For sure.
And people are paying less than they would if they were here. And so how do we kind of combat that from what can we do, what's in our power as an industry to kind of combat that?
Yeah, and I think you're right. I think despite the scary stories we see in the press, it's not deterring people. So I guess focusing on how we market, how we set ourselves apart, it's safety you're paying for, it's the qualifications, and it's also the backup should something go wrong, because things can go wrong in these treatments, is what people are sort of paying for, I suppose. And I guess focusing maybe more on that and the value that you're offering in terms of the overall care of that patient is usually how we try and sort of market ourselves as consultant-led and consultant-delivered care.
I think it's a sensible approach. I think a lot of clinicians struggle with communicating value, and I think we'll get on to sort of the NHS mindset in a bit, but I think that's kind of where there's a disconnect there. But hopefully people will learn, and I guess we'll have to have more horror stories for
yeah, and regulation. Ultimately, you can't save people from themselves sometimes, and I think it stands down to the government. Sort of, there's only so many horror stories that will come through before it's like, well, we need to take responsibility as a society to protect people from these complications that can happen.
I suppose treatment stacking is a good way to combat it as well. So you're going there for one treatment, but actually if you have a treatment here and all the other things that could work really well with it, whether it's regenerative treatments, whether it's laser, that could be a good solution. So it's not about that one outcome, it's about the whole experience. It's about the journey of how you'll start to feel better and the follow-up and why this clinic's a better choice.
Absolutely. And we get patients coming in saying that I'm looking to start my journey with you, my aesthetic journey, and that might be starting with surgery, but they're looking for a long-term relationship, someone who knows their face, knows what they've had done, and knows what's going to help preserve that result or enhance it in the future. And I think that's a really healthy way of seeing these treatments, because ultimately they all run up, they all wear out, and it's not always great to sort of shop around. If you can stick with one practitioner and trust, then you're likely to get a better outcome than kind of going around to a million different providers.
Absolutely, yeah.
I think by shifting the focus to outcome rather than treatment specifically, it sort of avoids commoditizing the treatment as well.
Yeah, absolutely, because you're not paying for a mil of syringe, you're not paying for a product, you're paying for that treatment, the expertise of that practitioner, and ultimately the relationship that will sort of bring you through your aesthetic journey and keep you aging well over time.
Yeah. There was a really good spread a few months ago now, I think, in one of the trade magazines about you and your personal life and how you juggle it all as a mum, as a business owner, as obviously your medical career. You still do NHS?
I do indeed.
One day?
I actually do, so 5 PAs, which is sort of 2.5 days commitment. It works out as 1.5 days of actual clinical work.
Yeah.
And I plan to continue that at the moment. I think it keeps me super grounded. I do all that, it's just eyelid surgery, but when patients are like, oh, I didn't know, they assume it's cosmetic. But actually there's a lot of functional concerns. We see a lot of eyelid cancer. And when you spend one day sort of recreating eyelids for someone who's had to have skin removed because of skin cancer, it puts things in perspective. So when patients come in and they might be focused in on a tiny imperfection, I think it helps you put things in perspective. And I think I'm probably more likely to say no to people than others. I've had patients comment and say, okay, if I go to someone on Harley Street, I'll just walk in and they'll do this for me. Why are you not giving me this treatment? I'm willing to pay. Right? It's not about that. I don't think it's in your best interest to have this right now. And I think, it keeps things in perspective. It keeps me current and, I think abreast of all the latest things that are going on from an NHS point of view. And also I think in the industry, there's a lot of practitioners who are loosely using the term surgeon, who may have done a bit of experience in junior roles, but when you actually look at the specialist register, they're not actually on it. They've never done that sort of level of job within an NHS setting. It's hard to get that experience outside of the NHS setting in this country. So I think, again, for sort of credibility and just keeping our kind of premier position within the industry, both me and my business partner have maintained small roles in the NHS.
That's good.
Yeah.
How was that first sort of transition into private care? Because obviously you were doing it in your clinic in Bicester, and it was injectables, so it was kind of lower value.
Yeah.
But how a lot of clinicians, especially the ones who have spent the most time climbing the ranks on the NHS, really struggle with the concept of charging for something.
Yeah, for sure.
Talking about price.
For sure.
They want to, be as far away as from seen to be selling.
That conversation.
Exactly, yeah.
Yeah.
I think sales it feels like a dirty word, and they just want to sort of distance themselves from that. So how have you kind of overcome that? And because I think a lot of people will be watching this thinking, okay, that's a big struggle for me. I struggle to talk about price. How does Jenny do it? Yeah,
and I think there's lots of different ways of kind of making that conversation better. I think one thing is, your website, wherever that patient's finding you, be upfront with the costs. I think we're probably one of the websites where we list out the exact cost of, where you're having the treatment, what you're having done. Our pricing is really transparent, whereas a lot of places might say like from or, price on application. I think that almost gets rid of the conversation partially for me. So if patients are like, oh, how much is it? Often I'll say, you can refer to it on our website, the pricing is all here, take them through it. But yeah, to start with, it's a difficult conversation. And I remember doing clinics, I didn't have a PA or a big team in my other clinic. I still don't. It's a one-man band when I'm there. And I remember when I started, sometimes I'd forget to charge the patients. Luckily, people are pretty honest in the countryside. I'd get a message later being like, oh, like you forgot to make me pay. I'm like, oh yeah, I did. And it is that sort of getting used to that process of, actually taking payment or discussing the price with it. I think, if you're not comfortable with it, just make it kind of, a formal part of your consultation. You talk them through what you're wanting to do, what you're suggesting to do, and before you're agreeing to treat or that patient kind of signing up to a treatment, just be transparent with the costs. And you can either follow up with an email if you've done that kind of initial consultation, get your PA to send it so it's distanced from you. If you don't have a PA, just get comfortable with the costs. Patients are doing these treatments because they want to do something that's going to enhance and improve their appearance. These are not essential treatments, so don't feel bad about asking patients to pay for them.
Do you ever worry that by sort of stating the price that you're potentially missing people who would be prepared to pay that price if they understood the full value of it?
Yeah, I see what you mean.
Because if I, let's say, go to your website and I see, okay, one session of Softwave or a package of Softwave is X, then it allows me as a patient to sort of have a look around.
Yeah.
But we know it's broader than that. We've talked about treatment stacking, which is about your credentials, your experience. And obviously, walking into the clinic Holland Park, you and your team's demeanor, the patient journey adds a lot of value.
Yeah, for sure.
So how do you sort of find that balance?
Yeah, and I think it's until you've sort of established a reputation within your area, that can be tricky. But I think the main thing is never devalue yourself as a practitioner. And I think when practitioners have both mostly been used to working in the NHS, they don't value their time as well because we're not paid well in the NHS. Like it's literally charity work compared to what you can earn in the cosmetic industry and in private practice. And I think when you start out, you almost feel like, oh, that's quite a lot of money for a small amount of my time, and you're comparing it to what you're getting paid for your NHS role, which is often more demanding, more stressful. You need it to be way more switched on for a lot of the things you're dealing with in that practice. And I think that makes you as a practitioner feel like you should be giving discounts. But I think remembering that a lot of this market is delivered by non-medical professionals, you've got to put value in your training and really kind of emphasize that in all of your messaging towards the patients that you're trying to attract.
Yeah, that's really really good, sensible advice. Is there any part of you that sort of keeps your one foot in the NHS just because you don't want to feel like you're turning your back on the NHS and betraying it, or perhaps that you feel like, and feel free, you don't have to answer if you don't want to, but do you ever feel like, NHS peers maybe look down on private or think that it's all about money or building a business or whatever? Because it's that fine line. And
it's an absolutely fine line. I just came to my sort of 3-year anniversary being a substantive consultant at Milton Keynes, which is where I have my consultant post. And you have a sort of meeting with one of the C-suite to kind of evaluate how your career is going. And the deputy CEO literally said, what are you still doing here? Because again, when you look at it financially, it doesn't really make sense to keep a foothold in the NHS. But I think if you think about what gives you job satisfaction, yes, I love my days at the clinic. I love making people feel great about themselves. But I also really value what I can deliver for my NHS patients who come in with a real issue that needs sorting, and actually being able to help those patients maintain sight and things is really, really valuable. And I think, thinking about what you take away when you're retiring, when you look back on your career, what are you going to place value on? So yes, while something might not make financial sense, it makes sense for me as a practitioner to keep my scope of practice broad, make me feel good about helping patients with actual real functional problems, and it keeps your skills really up to date. So obviously blepharoplasty is probably the most common cosmetic procedure we're doing at the clinic in terms of surgery, but the technical side of that is often much smaller, at least for upper lid blepharoplasty, than a lot of the operations we're doing on the NHS. So when you come to your private practice, you always want to be operating at a level kind of below what you're capable of, because there is no room for error. With private practice, like, the patients expect perfection. So you need to be operating at a level that you are super comfortable with. And so we always talk about kind of not going out of our scope of practice, but I almost think having that NHS role where you're doing, you know, complex operations, then when you are doing the more, not simple, but, you know, in some ways technically simpler operations cosmetically, it means you're well within your scope of practice and you know you can deliver 100% for those patients.
Well, that's a really, really good approach. And I think just in terms of what you mentioned earlier about, you know, your approach and, you know, looking back on your career when you're later in life and wanting to have that fulfillment, satisfaction, I think that says a lot about you as a person, your personality. I think you're very friendly, approachable. I've never seen an ounce of ego in there. And I think that's nice and refreshing, because there are some personalities in every industry, but in medical aesthetics as well.
Yeah.
And so I think that's really refreshing. And you know, I wonder how you juggle it all, you know, NHS role, your commitment to the clinic, your clinic back home, your passion for horse riding, being a mum, traveling. I mean, how many KOL relationships do you have? Probably half a dozen, if not more.
Yeah, no, well, not that many actually. I basically work with the companies that we're using a lot of. So obviously Cyton, that laser is going all the time, and they're a great company to work with. Softwave, I work with, Amila Polynucleotides, and then there's a couple more I do a little bit of work for. But really, it's kind of, I speak about what I'm doing on a day-to-day basis, and I think when I talk at the conferences and things, the feedback I often get was like, that was such an organic talk. I'm like, well, yeah, this is literally what we're doing kind of every day in the clinic. And I think that's important when you're thinking about taking on KOL roles. You really need to kind of believe in the technology and actually be using it firsthand. I think I'm fairly unusual in that I do a lot of the non-surgical treatments myself.
Yep.
There's a lot of like surgeons who will bring it on into the clinic, but they don't kind of, you know, do the treatments, because I think there is a big ego thing. It's almost like for surgeons, the non-surgical treatments are sometimes looked down upon, but there is a skill to doing them really, really well. And if you're not delivering them firsthand, are you the best person to kind of be talking through, you know, how you're getting your results and things? Probably not.
So obviously, as we've heard, you've done so much in your career already. Has there ever been any sort of setbacks or challenges where you've questioned the path you're on and thought, I'm not sure if this is the right route for me?
Yeah, and I think coming through training, and a lot of practitioners are still kind of in that training role within the NHS, the competition numbers are getting worse and worse. So I've got a fellow now at the clinic who was with me for a year because she wanted to get an eye surgery number, and actually the competition ratio is 22-1. She's got, her CV is better than mine was at that stage, and she didn't get placed. And she came to me saying, what should I do for a year? I really want to do ophthalmology. I'm going to reapply next year. I don't know what to do for a year. I kind of want to do the level 7, but I can't really afford it, which is why we sort of brought her in-house, and she's doing the level 7 with acquisition aesthetics, but I'm also sort of training her up in-house, and I think it can be really difficult for people kind of coming through. So yeah, coming up towards the end of my registrar years, I was doing my fellowship year with Richard Scorn, who's my now business partner, but there was absolutely no guarantee of a consultant job. And with oculoplastics, it's a super competitive subspecialty. And I think for the Southeast region, which I knew I needed to be in, there hadn't been a job advertised in 3 years. So I was exceptionally lucky when the consultant at Milton Keynes took early retirement to move fully into private practice. I knew I couldn't take a full-time role because we'd already started the clinic by that point. So I applied as a job share with a friend who was also coming towards the end of her training. And it was tricky. We kind of did all the pre-interviews, and a lot of people were questioning. They knew I'd set up the clinic, and they were sort of saying, you know, we don't really want part-time people. We'd want one of you full-time. My job share partner was a mum, and she knew she equally didn't want to have too much time away from her young family. So we had to sort of trust each other and apply together. And I think for women in surgery, it's still a really difficult time. There's only 16% of consultant surgeons who are women, which is a huge minority. And especially when you look at the ratios of women going into medicine, it's something like 60 or 70% now that are starting off at medical school, women. But then as you get higher up the ranks, people drop off for family reasons and things. And I think, you know, that is tricky. I still get now, well, you look too young to be my surgeon. I remember I turned up to do my ward round one day, and the charge nurse on the ward said, okay, medical student, like, just stay out of the way of the consultant. You know, they're always really busy. They need to go and see the patients, don't get in the way. And I was like, yeah, I'm the consultant. And that is really difficult. And I still get that from not so much my cosmetic patients, because they've usually looked me up, but on an NHS setting where patients don't know who you are, sometimes they're like, are you the surgeon? Are you going to be doing my surgery? And I really struggled with that early on. I was like, oh God, because you do get sort of imposter syndrome. You're like, am I qualified enough? Am I the right person to do this? And then, you kind of think, well, no, I am. I absolutely am. I've done all my training. I know what I'm doing. I'm the consultant. And now I kind of own it. I'm like, that's fine. I do look young, but, here's my card for my cosmetic practice. That's why.
I was about to say, because you're so good at your job.
Yeah, we hosted an event at the clinic recently in conjunction with the Oxford University Alumni Society, and they were doing it. I was doing a talk, they were doing an introduction, and they messed up my university year by like 6 or 7 years. They kind of de-aged me. I was like, oh no, I was finished by then, but thanks so much. It's obviously because I look so young. All the treatments were, come and shop here.
Great advertising.
Yeah.
That's brilliant. I love that. Yeah. So you mentioned imposter syndrome there, and I read somewhere that women experience it a lot more, particularly obviously in business settings. How have you overcome that? Yeah,
I think when you start a business, I've come at it from a mindset where everything is a bonus. If it doesn't work out, like obviously the clinic has turned out to be a huge success, but the first few years were pretty difficult, like not paying ourselves, making sure the lights were on, all the staff were paid, we were buying all the devices. It's quite tough. And I think, if you can come at it from a mindset that this is a journey, if it doesn't work out, if I don't make tons of money from it, at least I will have learned something and I will have enjoyed the journey. And I think if people come at it from a point of view where they're thinking, it's great, it's going to be a quick buck, I'm going to make tons of money out of this, it's going to be super easy and glamorous, you're always going to be disappointed. So I've always had the mindset where, this is all a bonus. I'm like so lucky and grateful that patients are choosing to come to our clinic and that, companies are choosing to partner with us. I don't take it for granted. There are a lot of unglamorous moments. Like it was just CCR last week and I was doing a couple of talks and I got held back because people were asking questions afterwards, but I knew I had a clinic booked. And there was one point where I was like running through Bond Street Station because I'd missed one of the Elizabeth line trains. And I texted my fellow and said, this is the non-glamorous bit that no one sees. And this is what you're signing up for if you want to make it a success.
Gosh, yeah, it's true. Did you ever think you would go into business? Was that always in the back of your mind, or was it all circumstantial?
Yeah, it was actually because I saw so much inefficiency in the NHS and it really, really grated on me because if you ever come and see how my clinic runs, I'm very much like efficiency. I love things running to time. I hate waste and I hate inefficiency. And when I started into aesthetics, it's because I was working in a unit where I was just thinking, the processes here are so wasteful that I could run this way better. And I think in an NHS setting, we're at the mercy of our managers and they're not always clinical. Whereas in private practice, and this is kind of the main reason I started my own practice, was like, I can run something better than this. And that's what I wanted to do, really. Yeah.
Yeah, close friend of mine is a max fac surgeon and he's sort of top of his game, as far as I can tell anyway. Really nice guy, but he doesn't come from an NHS background, and so he's been working here for a couple of years now, and he's really struggled with the wastage and also the culture, and he's quite direct and he's quite sort of bold and he'll say what he thinks. And in that sense he runs a really tight ship as well, and he's very efficient, but he's ended up sort of stepping on a lot of toes and the management layer, and he's culturally also he's Latin American and just it's a different approach, and so he's really struggled with that, where he'll be prepping for surgery and then a nurse will open all the scalpels and bits and pieces, and half of them actually aren't even being used, and they just go straight into the bin. It's like, well, that's another however many hundreds of quid just straight into the bin, basically.
Absolutely, yeah. And I think within my NHS practice, I'm calling it a compliment last week, there's within an NHS setting, there's always politics and it's sort of managing the managers and your relationship with them and the rest of the team. And one of my colleagues had said to a nurse who works for me, I really like Jenny because she works like a man. I mean that in the nicest possible way, but I'm pretty direct. I don't mince my words. I don't play games. And I think we're all, when you look at a team, whatever setting it is, whether you're in private or in NHS, you're all trying to get towards the same goal. And so working out how best to get there is all that what you're trying to do. So setting egos aside and just kind of saying what needs to be said and getting it done is kind of how I operate, which I think some people like, some people don't. But
how did you learn that skill though? Because you're also very approachable and kind, and as I said earlier, there's no ego there. So how do you sort of, you're obviously not a people pleaser because you're able to be direct, you're a COO, you're on a tight ship. So how do you find that balance? How did you learn that skill? Is it just the time constraints that you have? You just have to?
And I think it's sort of not putting all your eggs in one basket. It definitely helps. Like, if the clinic doesn't work out, I've still got an NHS job and vice versa. And I think, obviously having a lot of support within your family is really important. Something I haven't really touched on yet, but I think I've got a super supportive family, and I know that if things didn't go well in a business setting, whatever, I can fall back on my family for support. And I think being direct, it's kind of my personality, I guess. I don't like playing games. I like saying things how I see it, and I think it's often the best way to get things done, really. Yeah. And I have no ego. Like with my team, if people are busy, I'll be like, anyone want a cup of tea? I will help my team. And I think within your practices, if you can build a really close-knit team and they know that you'll go out to bat for them, if they go out to bat for you, kind of helps. And having that kind of direct conversation and relationship with them. If stuff needs doing as we have like really busy clinic days, and we have a little WhatsApp group that kind of keeps the day running, because there's lots of different rooms in the clinic and you might not be able to kind of go and tell someone they need to do something, and we all communicate very directly. It's like, there's a task that needs doing, it'll be put on a group. There's no sugarcoating what needs to be done, but all of us know that we kind of treat each other with respect, so that direct language is there so that we can achieve the best in terms of how we manage the relationship.
I bet that makes life much easier if everyone's kind of on the same page, and egos and almost, I guess, like emotions in that sense, in a work setting is taken out.
Yeah, and I think when you're assembling a team, if you do look out to kind of build a team with you, you've got to have people that you can work well with, and if you do get the occasional ego in, it can really kind of disrupt the team and be quite detrimental. So be selective with who you're going to work with. In private, we have that ability to choose who we're going to work with. You don't get that in an NHS setting. So if you're looking to build an efficient team, not having egos within that is super important. And the same goes to my business part. Like, I remember early on in the clinic, we had a leak downstairs in theatre. We were both fully booked, and I was sort of seeing patients upstairs while he was in his suit on his hands and knees trying to like turn off the water next to theatre. And it's just, having team members that you can work really well with is super important.
No, it's great. And you touched on family, so we should talk about that a bit. So when did you know you wanted to go into a medical profession? Was it from your family, or was it something that you decided?
Yeah, so I loved animals, which probably, it translates through to my personal life now, having small holding. And I wanted to be a vet. And I think I remember being like 13 or 14 and realising that vets also had to put animals down. And my mum at the time was like, well, they don't put people down. So you could look at medicine instead. I was like, yeah, that's a good idea. It sort of went from there.
That's hilarious. Yeah, no, it's a fair point, yeah.
Yeah. So, it was very much me driven. Neither of my parents are medical. They're not doctors anyway. My mum's a pharmacist, and my dad works in sort of the more medical engineering side of things. So kind of NHS family, I guess, but without actually being medical.
Yeah, and you studied at Oxford, is that correct?
Yes, I did.
And how was that experience? Because obviously I think it's still quite a small group of people that come from Oxford for medical anyway, from what I know, and people that we've spoken to on the podcast. So what was that like?
It was amazing. Like, honestly, the best years of my life. It's such a unique experience, and I think I didn't really appreciate that before I went there. But Oxford have ranked the top in the world for medicine for the past 12 or 14 years. I've forgotten now, but it just gives you such a great grounding. One, because your kind of first few years, you're not just with lots of other medical professionals, and I think there's a lot of courses where all your friends are medics. You kind of get a bit blinkered. You don't see the outside, what else goes on outside of medicine. Whereas with the Oxford system, you're kind of put in colleges, and then there would be like 6 of us in the year who are medics, but most of your friends are non-medical. And then I think when a lot of your friends leave after the first 3 years and they're going into a lot of business roles and things, it gets you thinking that there's actually more outside the treadmill that you're already set on from just doing medicine. And what is the timeline from going to university and actually practicing in the NHS? How long does that take? So most degrees are 5 years. Oxford is 6, so you do sort of 3 years of preclinical with a Bachelor of Arts kind of included on your 3rd year, and then 3 more years, so 5 or 6 years at medical school. And then you'd be accepting your foundation job, so that's generally 2 years. And then depending on where you're going to specialise, it varies. Ophthalmology is a run through of 7 years, so you do your sort of 7 years, and then you'd be eligible to complete your training, and then potentially take a consultant job straight away or do more fellowships after that. So it's a long run, but I think you've got to look at it as a journey, enjoy all of it, because people sort of starting out, they'll think, oh, well, that's going to be how many years until I'm actually a consultant? It looks like a huge amount of time, but actually all of it is fun. All of it has value, and it's about thinking about how you're going to enjoy that journey, not the end goal.
Yeah. And you went into aesthetics in that journey. Like that's something you probably didn't think about, obviously, when you were at university.
No.
But I think even now I'm starting to, with my brother, he's a bit younger, and his friends, they are thinking about aesthetics way earlier on in their journey.
Yeah.
One, for example, he's just qualified as a dentist, and he's already started his training for aesthetics. And he's like, well, it makes sense.
Yeah.
So do you think that's more in becoming more common?
Yeah, I think so. I think people are now seeing that the treadmill that we're all kind of sold, where you do your training and then you work full time for the NHS with maybe the occasional bit of private work, is not necessarily going to give you the work-life balance you want. And with a lot of the inefficiencies I sort of mentioned, people are looking to kind of branch out and have something that is their own as well. I think the earlier you can start training in that, the better, because we don't really want to do is sort of finish all of that surgical or medical training, get to the end of your journey, but have no experience in aesthetics. I think the people that have done that, I see, struggle because they're top of their game, they've done all their training, whatever their specialty is, but actually they're pretty naive when it comes to aesthetics, and it is its own specialty. There is a nuance to these treatments, and if you haven't also invested time to learn that alongside your main specialty, you're not going to be the best at that.
Yeah, definitely. I have this theory, and it is completely unfounded, that, as always, most of my theories are, that because the younger generation are more aware of aesthetics and they're sort of thinking about it when they're training, whether it's medical or dental, that naturally in maybe, 10, 20 years' time, there will be more medical professionals in the industry, and therefore this whole shift of non-medical medical might start to become less prominent because there's more people that are coming through that are medical much younger.
Yeah, absolutely. And I think when you look at the stats, it's something like 60% of these treatments are done by non-medical professionals, which is crazy. So hopefully that boost in more practitioners will come alongside regulation and sort of force it into medical hands.
Yeah, definitely. And something that we have on the sofa different people, and some are medical, some are non-medical. Do you think it matters if you're medical or non-medical, or is it the training that matters?
Yeah, I think that's a really good question. Training, and I'm not saying that all non-medical professionals can't do any of these treatments, because they absolutely can. But it's about what happens when it goes wrong. And I think if you're a non-medical professional working on your own without sort of a broader support network or someone to refer to or oversee your work, if you can't prescribe and you get an infection, for example, even if it's microneedling or something innocuous, what are you going to do? That patient's then going to have to go into the NHS setting or use their health insurance if they're lucky enough to have it. And I think as an industry, we do need some responsibility in kind of looking after our own complications and not burdening the NHS with that.
Absolutely. I think that's a really fair point. But my background actually was beauty, and I started to do aesthetic treatments within that.
Yeah.
And microneedling was one of them. And I remember being on the course and I was like, what happens if it goes wrong? What happens if someone has an infection? And the answer was you send them to the GP. Yeah. And that's obviously the NHS instantly having to pick that up, and that's not fair.
Yeah.
And I actually started to do it, and I was like, I don't know, I don't feel comfortable with this. And I stopped doing microneedling and had friends that went on and did injectables. And I was like, I could just never do it because that was one of my fears. I don't want to not have the answer when someone messaged you and says, look, I've got, a reaction or this or whatever it is, and I can't help you. So I've got to send you back to the NHS.
Yeah. And maybe in the future, what we have is there's going to be a lot of kind of non-medical professionals who are really trained and really skilled in these procedures. But if they're working within the scope under, a practice that has that support, because complications aren't common, but they do happen, and you need to get out plan really for when they do, and support for that patient, because ultimately it's all about patient care. Really.
Yeah, absolutely. Yeah.
It's a crazy world we live in. Back to the clinic for a second, because you mentioned that the earlier couple of years were the toughest.
Yeah.
And you sort of, you guys weren't able to take a salary, and you had to spend a lot of time there, obviously, to get up and running. What were some of the kind of realities that you wish you'd known? Like the sort of the holy shit moments.
Yeah.
Excuse my French.
Yeah.
That were like, okay.
Yeah.
That's new.
Yeah.
I wasn't prepared for this.
Absolutely. I think you don't realise the cost of things. So like business rates, I didn't even know they existed before the clinic. And I was like, we're spending how many thousands?
And they're really high where you are.
They're really high. Yeah. So even just to be there, you've already got some cost of how many £1,000. It's actually impacted my surgical practice. So I didn't realise how much stitches were, how much sutures were. So in an NHS setting, you're like, oh, there's a little bit left, but it'll be easier if I just open a new one. Now I'm like, I use every last bit of that stitch because they're so expensive. I think just, realising that obviously the NHS has its problems, but the buck does not stop with you. And And, there's people have defined roles and your role is just clinical. You don't have to worry about the running. You don't have to worry about the finances. When you start your own practice, buck very much stops with you. As I said, I'm usually the first one in, last one out. And that's because there's a lot around that kind of practice that keeps it running. And I guess just knowing how all-encompassing it would be is something I hadn't quite appreciated early on.
How have you managed the sort of the people side of things? Because you're obviously a great leader. You built a good team and a good culture, but I guess that takes trial and error. So you found the whole recruitment side of things, managing a team of people, being responsible for their career pathways, the HR side of things, having one-to-ones, developing people. How have you found that entire piece?
Absolutely. And I think if you looked at our clinic when it started, the team that was there with us at the beginning is not the team you see now. And it is a lot of trial and error because you don't know people until you start working with them. They might come across great in an interview, but until you actually get that person as part of your team, you don't know how they're going to work. And I think the people we've got now, we've got quite a small team, to be honest, in terms of like the support team. We employ like 5 people, but they're solid. They are there and they show the reason they sort of have stayed is they're like, I'm here for you. We sold the clinic last year to a bigger partnership called CPP. But even now the staff are like, Jenny, I work for you. Like I turn up every day and I do what I do because I love working for you because you look after me. And, the respect kind of works both ways, I guess.
Yeah, absolutely. So, I mean, we don't have a set statistic on this, but it is believed that businesses that set up within the aesthetics industry usually close within the first 2 to 3 years. And it could be various factors. We don't have exactly what it is, but I can probably guess its costs is a big one, marketing, competition. Was that ever a concern for you, or were you like, I'm just going to do this and give it a good go?
Yeah, I think, as I said earlier, this was always going to be, anything that happened from this business was a bonus. I wasn't seeing it as like my bread and butter. This had to succeed. I was seeing it as something that I enjoy doing and passionate about, and seeing it as sort of a challenge, something to build and try and really make a success. And I think it's about mindset when you go into it.
Yeah, and why do you think other aesthetic practices have struggled? What do you think is probably the reason why they've closed?
Yeah, I think not being realistic about how things are going to go with your business. We know that most small businesses are going to turn a loss for the first couple of years, and if you're not prepared for that mentally, it can be pretty depressing when you're sat there like, I'm working so hard, why am I not making any money? And I think with Instagram and all the social media platforms we have now, the industry is kind of glamorized, and I get lots of juniors saying to me your life looks so glamorous. I'm like, well, there are bits of it, sure, that are, but there's a hell of it that is not. As I said, like running through Bond Street Station to get there on time for the first patient on Friday, not particularly glamorous. Working, through the night sometimes when we've got something deal on the deadline. Like, this is the work behind it. It's what people don't see. And I think you mentioned earlier my meteoric rise. Well, people are like, well, how have you done it so quickly? It's like, well, I've worked harder than I've ever worked in the last 3 years. And my fellow that started now, she's only worked in the NHS before, and she saw what I was doing. She thought it looked really glamorous and interesting. And I did say to her before, like, it's going to be hard work. And she's been with us about a month now, and she's like, you work 10 times harder than I've ever worked or seen anyone work in the NHS. I was like, if you want to make it a success, it's your business. The buck stops with you, and ultimately you're going to get out what you put in. So even now, we're 3 years down the line, the business is going really well. I'm working harder than I ever have before because I'm pushing it further. And I think you can only do that if you're enjoying it and you're passionate about it.
Absolutely. And I literally used to drive past the clinic. So I remember the building going up and there was a sign saying something coming soon. And I was like, oh, what's that going to be? And at the time I had a salon where we were doing treatment. So I was literally driving past and I'd watch it just evolve into a stunning space. When you went into it, did you visually know exactly what you want? Did you think about the patient experience from day one? Did you think about the feeling that someone has when they come in or even drive past? Was that a factor?
Yeah, so I have to say I wasn't particularly involved in the interior design of it. It's not my forte. If anyone comes to my house, it's like a mishmash of furniture basically. So Richard, my business partner, was more involved in it on that. It was all of his project really.
I knew there had to be a weakness in there.
Yeah. And we had a great support from an interior design company as well, who kind of translated his vision into it. Yeah, interior design is not my forte, I have to say.
It's an amazing space where it does evoke a feeling, and I guess that feeling is translated then into an experience. So what is the patient journey like for someone that walks into the clinic for the first time?
Yeah, and this is something that's evolved as we've got busier and busier. So we've got our support team of about 4 or 5 people, and they're basically, on the days that I'm in clinic, they are all in. And so that patient journey, we know it starts even before they get to you. So whether it's that initial kind of conversation where they're booking, we'll have someone sort of always on the phones or answering emails as quickly as we can, because we know that, you know, if you get back to someone super quickly, they're way more likely to come to your practice. So their journey sort of started in the interaction, the conversations they've had even before they've walked in the door, the reconfirming all of the appointments, managing the patient's expectations as to, you know, what to expect on the day, depending on if they've booked in for a consultation, are they going to be able to have treatment on the same day? So that patient kind of already has an idea of what's going to happen. We then have a fairly kind of slick process, and on my team know they've got sort of defined roles between that patient journey. So whether it's the junior doctor kind of prepping the patient, removing makeup if they've come in without, doing any imaging, checking a medical form. We do send it all out before, but most patients, you know, don't fill out paperwork. And then patients get to see me. We decide what we're doing on the day. Sometimes they've already had a consultation and they are then booking in for a treatment later on, or they're wanting treatment on the same day. And then it's the aftercare. And the aftercare is something that we often get patient feedback on that's really good. Like, I personally contact all my patients day 1, day 14. They all have my direct phone number, my email, which most practices and most consultants don't do. I think there's an old school, if, you know, consultants 10, 20 years ago, you'd never give your contact details to patients. But now I think people want to be able to contact you, and they don't generally abuse it. They just like the safety net. Actually, if I have a problem, I can contact you. Yeah, and I think that's the patient journey. And then it's following up and making sure, you know, does that patient need anything further? Are they interested in any other treatments? I used to do a lot of that conversation myself. Now we've got a great support team. I usually let them sort of follow up with the patients who are wanting more comprehensive treatment programs. So we'll get patients coming in saying, you know, I want these few treatments actually over the course of the next year. Can you put together a treatment plan for me? And I think having a team that understand how you manage your patients generally really helps with that. So for example, our social media manager, she's the social media manager now, but she was our front of house for a few years, so she's had first-hand experience on what we're doing in our clinic, and that translates through to the messaging that goes across our social media.
That's really important.
Yeah. So she moved abroad and for her husband's work, and she was like, oh, I really still want to work with a clinic. I was like, well, this would be a great fit because you already know what we're doing. You know the team, you know the personalities, you know how we manage our patients and what treatments do well. So it made sense to kind of translate that.
That's great. Yeah, amazing. And do you think your patients are quite well informed now because of, I guess, everything and all the work you've put in, or are you still finding you're having to do a lot of education when people come in?
Yeah, I think partially. Some people are really well educated. They've come seeking you out because they've done a lot of research on you. On our website, we try to be quite comprehensive in information about the treatments, so FAQ questions. And one thing we found recently was ChatGPT were recommending us for a lot of treatments. And when I asked ChatGPT why, they're like, well, you've written lots on it. You know, there's a lot of you know, content there out on the web where it's associated with a particular treatment. And so we do try and make sure we're sort of publishing all the journals. We're also making sure our kind of website is up to date with current information so patients can really see exactly what to expect from these treatments.
Yeah, amazing. That's great.
I think when you first launched, I remember looking at your website, or not when you first launched,
yeah,
you know, within the first sort of year and a half.
Yeah.
And you guys were one of the few websites that you could navigate by concern as well as by feature.
Yes, yeah.
And that was really refreshing because you just end up capturing a large share of the market, or website visitors that perhaps don't know what treatment.
Yeah, absolutely.
Lends itself well to that more educational approach.
Exactly, and a kind of less commodity approach.
Yes, yeah.
Absolutely. No, that's really interesting. And something that I think a lot of people don't do is focus on their website anymore. It's like they've gone like the opposite way, and they're all focused on social media, but actually having your social media, you know, obviously ticking along, doing really well, answering patient queries and all that kind of thing, but it still needs to point back to your website. And having concerns is such a great idea that actually I don't think many people have caught on to yet.
Yeah, no, absolutely. And I think for the younger generation, certainly the Meta platform, Instagram, is all encompassing. But a lot of our patients don't look at Instagram. They don't use it. They're in a demographic where they're not scrolling on their phones all day long. And websites are still super important to make sure you've kind of optimized and really make it reflect you and your offering.
Yeah, absolutely. No, really interesting.
Before we sort of wrap up, there's a couple more questions, but before we wrap up, you mentioned you sold the clinic to CPP.
Yeah.
If you're able and willing to talk a bit more about what that vision looks like and what people can expect of you in the clinic going forward?
Yeah, absolutely. So the sort of conversation started last year, so 2024, and we were introduced to CPP through Cyton, actually.
Okay.
So CPP have done really well in the US. They've got about 60 partners there, and a kind of blueprint, I suppose, where the idea is to kind of collaborate and bring in a partnership network of physician-led and physician-delivered clinics, so sort of these top-tier clinics, really. And I think the idea was just really refreshing because there's not a lot of collaboration within aesthetics. Like within London, you've probably got 100 clinics within a few miles around you. You're all competing in the same patient pool. And collaboration isn't something that we do well within the private industry. So, yeah, I think having the opportunity to be part of that was really appealing, especially when we looked at who the other partners were being looked at for the kind of UK launch. So knowing that they'd already done really well in the US and knowing some of the names that were already on board in the US and having conversations about how those practices had found the integration made it a really appealing option for us. We'd had some other conversations with potential mergers, private equity, but we didn't really want to lose our identity and kind of lose control of the business that you've, blood, sweat and tears has gone into building. So what they offered really was a sort of, moderate approach where you're partnered in. The buck doesn't necessarily stop all with you, but it kind of does. You have autonomy still in the services and how you run things and your staffing. And that was just, super appealing. And I think what hinged it for me was looking at how they're going to grow in the future. Is this a club that I could afford not to be part of?
Yeah.
And looking at who they've got in the US 3 years on, I was like, if I was in the US, I would want to be part of that club. So that's really what kind of made us decide to take the leap and join them. We completed towards the end of October last year now. And I think, if anyone's thinking about sort of selling their practice, don't underestimate the amount of work that goes into that, because that year was just a bit of a blur. It's like running a third job, essentially.
Due diligence exercise.
All the due diligence, we're medical professionals. We're not lawyers, we're not accountants. And I'm lucky enough that my husband actually is a chartered accountant. He works and he's he's a finance director. So I had his support in it. But I've never sold a business before. As we got towards the end of the deal, it really did ramp up in terms of the intensity of all the legal documents and things
and stuff.
And I think as doctors are used to signing whatever piece of paper is put in front of us and not actually reading it, and you're like, okay, no, I actually need to read this. It's super important. So the process of the sale was a whole thing, but now we're out the other side, and seeing it continue to grow is really great.
That's really interesting. I'd never heard of them actually, and there's a few parallels like that in dentistry where it's not, so in dentistry you have these large corporates that have like 500 clinics across the UK, but you also have a growing number of smaller sort of hybrid corporates that take strategic stakes in clinics, but they leave a lot of the discretion of how they operate and the branding and so forth, like
centralized.
And so they would sort of retain their patient experience, they retain their community vibe, and they don't just come in and refurb and put a new logo on it.
Absolutely. I think that's important because also if you're coming in as a buyer, you're wanting to buy something that's good and successful. So why would you want to debrand and change it? I think if something's working well, you just want to help support that process rather than integrate it into a bigger conglomerate.
Great. So we might be seeing more then. So that sounds really interesting. Do you want to go into the confessional?
Yes, we do always have to ask this question. I don't know if you've seen it before. But basically, we need to know a juicy story. It can be NHS, it can be patient story, where it either left you shocked or just like, I can't believe that's happened to me. So have you got a patient story you can think of? I'm sure you probably have a few. I feel like anyone that's worked in the NHS seems to say, I have loads.
Yes,
yeah, I'm trying to think. Yeah, let's go for, so recently, as I said, we see a lot of complications. And recently I had a patient come in and she had what looked like, and I thought it was an abscess on her face. And she'd actually had filler to the area. Not sure where. She didn't want to divulge that, and that was totally fine. The lump had sort of been there a little while, and she had a history of keloid scarring. So she was like, can you just inject some steroid? A couple of dermatologists have done that. And I was like, I think it looked like it was pointing. It looked like there was pus in there. And I was like, I don't really want to inject steroid, but I think there could be an infection. We need to do some hyalase because there could be biofilm, and we need to, get rid of it. So went in to kind of inject the hyalase, and of course it burst open with all of this pus. So I had my fellow there, like first day on the job, collecting pus in a syringe as I was sort of squeezing it out. So we sent it off to the lab, put the patient back on some antibiotics. I was like, we'll be in touch. And then my team, we were between patients. It was a really busy day. And I came out to the front desk and they were like, it has been 10 minutes. I was like, what? They were like, well, we just got a call from a microbiologist who wouldn't wait on the phone to speak to you. All they said was something about TB. And I was like, what? I was like, call them back right now. And anyway, the preliminary kind of result had grown mycobacterium, one of which could be tuberculosis. And they'd had this sort of garbled message about, you might need to contact trace and all this stuff. So my team were all freaking out that we'd all got TB.
Oh my goodness.
A quick Google kind of, reassured us that actually there's lots of different mycobacterium. But it can happen as a kind of contaminant if someone's put water, it's often in water. So if someone's had filler treatment potentially, but the skin has been cleaned or something's been contaminated with tap water, then it's something that can happen. So having to call, I didn't have the patient was not from this country. She had a broad number. I was sort of emailing her being like, could you just give me a call now? She's like, couldn't you just email me? I was like, it's a bit delicate. Like, I just want to talk to you over the phone. Yes. And I had to phone her and be like, I don't think you've got TB, but I just need to check if you've got any symptoms of it. Because if so, we all need to go and get tested right now. That's probably the juiciest one that comes to mind in recent memory.
It's mad. Oh gosh, that must have been like a whole day of just panic for everyone. It's like the whole place will panic.
Exactly.
Any contact tracing for you? I mean, not only do you see people in a clinic setting,
I know.
Events, trade shows.
I've got another juicy one that might be better to share actually. Yeah, when we set up the clinic, it was obviously COVID.
Yeah.
And we had a launch party, and it was all done within the regulations. We're in one of those weird pop-ups where you're allowed to integrate again. But it was at the time where you still had to contact trace. So everyone piles into the clinic, we're all having a great party. And the next day I started having a fever. I'd also been to our NHS sort of work lunch. So at this point, we had to contact trace, and I had to text all my colleagues. I took out an entire ophthalmology department because we all had to go and test and isolate. And then everyone at the clinic, we all got COVID. So our launch event was like super spreader. It was a super spreader.
Oh gosh, the days.
Exactly.
We hear so many pandemic stories. Like it was another world, wasn't it?
Absolutely.
Oh, that was great.
My wife and I, we had like a big joint birthday party. We invited like 35 friends, and the next day we were down. You were down,
yeah.
Sorry guys.
I mean, I had a slightly different experience. I went to a drag karaoke night. Everyone was singing Sweet Caroline. I knew it was going to end with COVID, and it did. 2 days later I was in bed and everyone was just sick. Not quite the same, but still a great night.
Yeah.
Oh, those are good stories. Thank you. We got bonus story too.
Yeah, exactly.
Good. Well, Jenny, you've been incredible. Thank you so much for being so generous with your time and sharing your story and your knowledge. If you have, one last piece of advice for any practitioners who are looking to get into this industry or who are in this industry and they're trying to build their career, trying to build their business and their clinic, what would that advice be? Quite a big question.
I think enjoy the journey. Don't focus on the end goal. You've got to enjoy the journey, and if you happen to make a business success of it at the same time, then that is a bonus, but don't take anything for granted. Just enjoy yourselves, and you've got to be passionate about it. Don't think about the big bucks you may or may not make. You've got to love the industry and love the art, really.
Absolutely. And where can people find you?
So you can find me at the clinic Holland Park in London.
Amazing. And we have to ask this question. It's really the last question.
It's the triple last question.
Yeah. But this is the last question. Is the patient always right?
Absolutely.
Tell us why. Why do you think they're always right?
So in any aesthetic treatment, these are treatments that patients are having because they want, not because they need. And so the patient is always right because ultimately you're trying to achieve and meet their expectations. You're not treating something functional they need to have for their health. So you are very much led by the patient and they are always right.
Love it. Well, thank you so much for your time. Honestly, it's been great. I feel like I could ask you 100 more questions, but we won't. You're busy. But thank you so much.
Thank you. Thanks for having me, guys.
Love hearing the real stories behind the aesthetics, medical and dental industries? Make sure you follow us on Instagram and TikTok at The Patient Is Always Right for exclusive content. You can listen on Spotify, Apple Podcasts, or wherever you get your podcasts. And don't forget to watch the full episodes on YouTube. Hit follow, subscribe, and stay tuned.